as we start to head deeper into fall, youth sports once again starting up again all over the country. High school football players in Texas hit the field this week. The same week, the Pac-12 announced it will kick off conference play on November 6th. All had been pushed back for COVID. I spoke with the director of sports medicine at Rush University Medical Center about the risks that all parents and youth athletes need to know about.
Is it safe for kids to practice and play sports in groups?
I think in general, given that we're in a fall season, that sports can be largely played outside, there is the ability to do some cohorting during practice. I think that as long as the community is at a state where they're allowing some in-group, small group activities to return, we probably can find ways to get kids back to sports.
Are the current safety protocols for athletes enough right now?
I think they are enough right now. The problem is that, we're getting bits and pieces of information regarding specific risks to players. The most recent that's come out is about the cardiac risk to players associated with something called myocarditis, which is inflammation of the heart. And of course, these things are very worrisome. They're worrisome to healthcare professionals, they're worrisome to parents, coaches, and other people who are in charge of youth sports. The problem is that the information is very limited, and we really don't know how to act on that information at this point.
Go, get low, get low.
I think what's important to note is that we now have had experience through the fall season with professional sports, collegiate sports, in many areas high school sports, as well as club sports, where patients, kids, athletes have gone back. And we've seen very little risk of actual significant cardiac events occurring.
So what is your advice for parents and athletes, youth athletes and coaches when it comes to sports right now?
My advice is if you have not had a COVID exposure, you have no known COVID test, you're feeling normal and healthy, it's participation as usual. The second group of patients are the patients that have a test but are asymptomatic, meaning for whatever reason, based on exposure or some testing protocol, they have a test. I think they need to go through the 2-week quarantine period. And generally, if they're having no symptoms, they can return to sports. I think the hardest group are those players that have had COVID and have had a symptomatic case of COVID, meaning they've had symptoms such as fever, muscle pain, fatigue, those types of symptoms. Those are patients that I think need to be seen by a healthcare provider and probably should undergo some basic level of cardiac screening prior to returning to sports participation.
What about winter sports, which are indoors?
As we get indoors, obviously the risk level starts to increase. The good news is that the size of the teams for most of these winter sports is markedly smaller. Then we have to couple that with what does this look like as we get into November and December? What's the actual disease burden? How many cases are in the community? What's the presence of a vaccine that's starting to come out? So I think, unfortunately, just like many of the things with COVID, this is a week-to-week decision. And the decision that we say is safe or unsafe now may look markedly different by the time we get to a basketball season in the middle of November.
And you can find a link to the CDC guidance for best practices on restarting youth sport, teen events online. One other question I asked him real quickly, I said, I see kids practicing and warming up in masks. They take the masks off for play. I said, what is the medical advice there? He goes, we can't reasonably assume that kids are going to be able to practice and play their games with masks on. So he said, moving forward, follow the guidelines, but it's really difficult to participate in athletics with a mask on.
Sure. The breathing, does it impact you while you're out
Yes.
there kind of running around?
Exactly.
Interesting. Glad you brought that up. Thank you, Marnie.